looking forward, I really want to talk about where we're going in this industry. And I think we're at a unique inflection point. And this picture here at the bottom, this is the Eastman Kodak plant in my old hometown of Kingsport, Tennessee. So my dad worked there. He was an engineer, and his dad worked there. It's hard to talk about in a way. And I remember one of my earliest memories was we had, I was probably 4 or 5 years old. This was probably 1972. And I remember we had one car as a family, and my mom would drive my dad to work sometimes, and I'd sit in the back seat with them, and we'd go in this plant, and you could see the webs of train tracks and different things going on. I'd see the trains there, and I thought my dad drove the train, because he was the engineer. I thought that was the coolest job that anybody could possibly have. Later I came to understand he was a chemical engineer, and I still have no idea what a chemical engineer does. But the interesting thing about the Kodak story, I mean, this was one of the iconic American brands, if you go back 30 and 40 years. And they owned many of the patents for digital film. And their engineers inside the company were saying, we need to move to digital. This is coming whether we like it or not. And the business side says, we've got a really good business in the film. We don't see a need to change. So they're really an industry that they saw the opportunity coming, they saw the change, and they really couldn't bring their way to transform themselves. And I think we're at a similar inflection point when you think about community mental health and all that's going on. First, we're doing great work. Recovery is real. We're changing lives every day. We're helping people every day. We're making a big difference. We're all here. We're all here today because we're committed, right? But if we look around us, a lot is changing. We see health reform. We see cuts to mental health services, billions of dollars in cuts. Parity, the impact of parity. We have new technologies coming in that allow us to provide services and think about services in ways that we never could before. Pay for performance, outcomes. How are we going to use that data to improve what we do and get paid for it? The impact of different changes in our workforce. How do we use peers more effectively? How do we change and rethink and reimagine what we do?